Hi, I'm James. I've been living with eczema for a while now, and today I'm here to show you how to use the Adbry auto-injector to take your medicine. This is the Adbry auto-injector. Your healthcare provider should show you how to prepare and inject Adbry using the auto-injector, and go over your prescribed dose before you inject Adbry for the first time. This video will give you a refresher on how to do the injection. If this is new for you and you're feeling a little intimidated, I completely understand. You and I are in this together, so I'll walk you through each important step. When it's time, you'll follow these steps. We'll get ready by gathering all of our materials. Next, you'll prep your injection site. Then you'll inject Adbry. Now, before getting started, it's important to read the instructions for use that came with your Adbry auto-injector. Ready? Let's go. When you gather your materials, be sure to pick an area with a clean, flat, well-lit surface. Before you start, you'll need your Adbry auto-injector, cotton balls or gauze, an alcohol wipe, and a sharps disposal container. If you need a sharps container, you can get a free one by calling the Adbry Advocate program. But don't worry, we'll talk about other options for disposal containers toward the end of this video. Here are some important reminders about how to store your Adbry auto-injectors. Keep them in a refrigerator in the original carton and protected from light until you are ready to use them. Adbry can be kept in the original carton at room temperature up to 86 degrees Fahrenheit or 30 degrees Celsius for up to 14 days. If you remove Adbry from the refrigerator, write down the date on the back of the carton and use the auto-injector within 14 days. Do not freeze Adbry auto-injectors, and do not use them if they have been frozen. Do not shake, heat, or put Adbry into direct sunlight. Now, take your Adbry carton with the auto-injectors out of the refrigerator. Check your carton's expiration date. Do not use the Adbry auto-injectors if the carton is expired or if the seal is broken. Each carton contains 2 Adbry auto-injectors. When you're ready, take one auto-injector out of the carton. Put the carton with the remaining auto-injector back into the refrigerator. Do not remove the cap on the auto-injector until you are ready to inject. Now, it's time to let the Adbry auto-injector warm up to room temperature. Place it on a flat surface and wait at least 45 minutes before you inject Adbry. This will help to reduce discomfort. Now, a couple of things here. Do not microwave the auto-injector, run hot water over it, or leave it in direct sunlight. Do not shake the auto-injector, and do not put the auto-injector back in the refrigerator after it has reached room temperature. Once your Adbry auto-injector is at room temperature, you'll need to check it for a few things. First, make sure the name Adbry is printed on the label and check the expiration date. Next, let's take a look at the medicine through the viewing window. The medicine inside should be clear to slightly pearly and colorless to pale yellow. You might see small air bubbles in the liquid. This is normal. You do not need to do anything about it. Do not use the Adbry auto-injector if the expiration date printed on the auto-injector label has passed, the medicine is cloudy, discolored, or has particles in it, or if it looks damaged or has been dropped. Be sure to get a new Adbry auto-injector if you need to throw one away, and remember to dispose of the auto-injector in a sharps disposal container. In this step, you'll choose the area where you want to inject and prepare your skin for the injection. You may inject into either your stomach area or your thighs. A caregiver can inject into your upper arm too. Just be sure they read the instructions for use before they start. Now, this is important. Do not inject through your clothes, share, or reuse your Adbry auto-injector. Do not inject where the skin is tender, damaged, bruised, or scarred. Also, do not inject within 2 inches or 5 centimeters of your belly button. And be sure to rotate the body area with each injection. In other words, do not use the same body area 2 times in a row. Next, you'll wash your hands with soap and water before cleaning the injection area. Today, I'm choosing my thigh. I'm using the alcohol wipe in a circular motion to clean the skin. It's important to let the area dry completely. Do not blow or touch the cleaned area before injecting. Okay, we're going to use the auto-injector now. I promise you've got this. Holding the autoinjector with one hand, pull the cap straight off with your other hand, and then throw it away in the sharps container. The needle guard is now exposed. It is there to prevent you from touching the needle. Do not try to recap the autoinjector because it could make the injection happen too soon or damage the needle. And do not touch or push on the guard with your finger because the needle could stick you. You can gently pinch the skin where you cleaned the injection area or give the injection without pinching the skin. Be sure to follow your healthcare provider's instructions on how to inject. First, place the needle guard of the autoinjector flat against your skin at a 90-degree angle on the area you cleaned. Make sure you can see the viewing window. Do not change the position of the autoinjector after the injection has started. If the autoinjector is removed too soon, you may see a stream of medicine coming from the autoinjector. If this happens, you may not have gotten the full dose and you should call your healthcare provider. Now press down the Adbri autoinjector and hold pressure. You'll hear a click to let you know that the injection has started and the yellow plunger will start to move. The yellow plunger will move to the bottom of the viewing window as the medicine is being injected. It may take up to 15 seconds to inject the full dose. You'll hear a second click when the yellow plunger fills the viewing window. Keep pressing down for another 5 seconds. Pull the autoinjector straight away from the injection area. You'll see the needle guard slide down and lock into place over the needle. Now place a dry cotton ball or gauze pad over the injection area for a few seconds. It's important you do not rub the injection area. There may be a small amount of blood or liquid where you injected. This is normal. If you need it, cover the injection area with a small bandage. Next, check the viewing window to make sure all the liquid has been injected. If the yellow plunger does not fill the viewing window, you may not have gotten the full dose. If this happens, or if you have any other concerns, call your healthcare provider and call Leo Pharma at 877-494-4536 to report a product quality complaint. Great job! You did it! After you're done, put the used Adbri autoinjector in an FDA-cleared sharps disposal container right away after use. Do not throw the Adbri autoinjector in your household trash. You can throw the cotton balls, alcohol wipes, and bandage wrappers into a regular trash can. I mentioned that you can order a free sharps container by calling Adbri Advocate. In the meantime, you can use a container like the ones that hold laundry detergent. The container should be made of heavy-duty plastic and be able to close with a tight-fitting lid, without autoinjectors being able to come out. The container should also be puncture-resistant, be upright and stable during use, and be leak-resistant. Make sure you label the container to warn others about the hazardous waste inside. When your container is almost full, follow your local guidelines for the right way to dispose of it. There may be state or local laws about how you should throw away used Adbri autoinjectors. For more information about safe sharps disposal and for specific information about sharps disposal in your state, go to the FDA's website. If you have any questions, reach out to your healthcare professional or call 844-MY-ADBRI for support and resources. Thanks for joining me today. Now that we've covered the steps, I hope you're feeling confident about using the Adbri autoinjector. Before you go, please listen to the important safety information scrolling next.
Indication and important safety information. What is Adbri? Adbri, tralokinumab LDRM injection, is a prescription medicine used to treat people 12 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbri can be used with or without topical corticosteroids. It is not known if Adbri is safe and effective in children under 12 years of age. Do not use Adbri if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbri? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbri. Are pregnant or plan to become pregnant. It is not known whether Adbri will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbri during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting mother-to-baby.org/ongoing-study/Adbry-tralokinumab/. Are breastfeeding or plan to breastfeed. It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed instructions for use that comes with Adbry for information on how to prepare and inject Adbry, and how to properly store and throw away, dispose of, used Adbry pre-filled syringes and auto-injectors. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single-dose pre-filled syringe with needle guard or as an auto-injector. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injections of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. In children 12 years of age and older, it is recommended that Adbry be given by or under supervision of an adult. If you miss a dose, inject the missed dose as soon as possible. Then continue with your next dose at your regular scheduled time. If you inject too much Adbry than prescribed, call your healthcare provider or call Poison Helpline at 1-800-222-1222 or go to the nearest hospital emergency room right away. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis. Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives, eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include upper respiratory tract infections, eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.